So one of the problems with having a large, bloated, and bureaucratic system is that it makes it a prime candidate for fraud. Yes, you heard me right. FRODD, fraud, especially with Medicare. Now, there are all kinds of ways that fraudsters can game that system because, once again, it's all based on codes and lining up those codes with the charges and that kind of thing. And it's very complicated and cumbersome, which makes it difficult to detect when it's actually a criminal trying to scam money out of the system. And there are multiple ways that this can happen. For one, there are billing for services that are not rendered. So you bill Medicare for all kinds of things. The most common ones are durable medical equipment, nursing services, therapy services in home, for example, sometimes even labs, MRIs, PET scans, or even surgeries. Okay? So they just fabricate the documentation as though they provided these services and for patients and then bill Medicare for that. There are also kickbacks or illegal incentives or bribes for referrals or certain healthcare services. These violate the kickback laws and inflate the cost for the taxpayer. There is upcoding. Here's a creative one. This is where you take a less expensive service and embellish either the amount of services rendered or the complexity of the services rendered so you can bill for a higher reimbursed service. There is also something called debundling. That's where you take a service that is supposed to be part of a global charge and break it into a lot of little individual charges to maximize that reimbursement. There's good old-fashioned identity theft as well. This is where the fraudster will take the Medicare number from an individual and rack up a bunch of fraudulent charges without the individual even knowing about it. These fraudsters will even take the Medicare number from people who have died and then rack up as many charges as they possibly can before Medicare catches on that the individual is deceased. And unfortunately, it is very prevalent. Medicare estimates that annually, $75 billion goes directly out of the pockets of you as the taxpayer and right to these fraudsters. That is the equivalent of 7 million people paying every single cent that they pay into the healthcare system going directly to fraudsters. That is the equivalent of the population of Arizona, to put that in perspective. And unfortunately, this doesn't just happen with Medicare. This also happens with private insurance. Unfortunately, they don't keep track of it even as well as Medicare does, but there's a lot of money lost there as well. That's what happens when you have a bloated bureaucratic system. It's one of the things that we need to address in order to achieve meaningful healthcare reform.